Welcome to Thoughtful Thursdays. Today we're going to be talking about skincare while you're traveling and skincare in the sun, and I'm talking to Dr. Razan today.
Hi, nice meeting you.
Dr. Razan, what kind of questions do you most commonly get asked regarding skincare in the summer?
The most important question is how do we protect ourselves or our skin from the sun exposure? The sun is containing a lot of benefits. First of all, we have to be sure that the people and the person has enough sun exposure to develop vitamin D. But this amount of sun exposure will not exceed the limit of developing a skin cancer. So it's a tricky thing because the same wavelength that develop the vitamin D, the same wavelengths will gonna develop the skin cancer. So we have to be careful about the amount of the sun exposure we will gonna make. We have to educate the patient or the people about the sun exposure. So I want to speak about ultraviolet overall. So there's ultraviolet C, B, and A. So ultraviolet C will gonna be absorbed from the ozone layer completely. Ultraviolet B will be absorbed 5% of the ultraviolet will be absorbed and it will gonna reach the earth. And the ultraviolet B is important for the developing of vitamin D and for the developing skin cancer.
Okay, so UVB then is the dangerous one.
Basically, the most dangerous and the most important one. 95% of the ultraviolet is ultraviolet A, and this ultraviolet A will develop an aging of the skin if we expose to it. Ultraviolet B can be stopped in the window. So whenever the ultraviolet passes through the window, so it will reflect the ultraviolet B. So ultraviolet B is just outside, outdoor.
Well, that's actually quite helpful to know because
exactly.
Sometimes we're not sure which kind of sun we're getting exposed to and what we need to be doing. And would it even be stopped by a car window, for instance?
Well, the pollution will stop penetration the ultraviolet B.
Which probably explains why even in living in a hot country there's so much vitamin D deficiency.
This is one, because actually on the hot country people are not exposing enough to sun. Moreover, in the hot country the skin color is darker. So whenever you have a lighter skin color, you need less amount for the ultraviolet to produce vitamin D and to develop skin cancer, while when you are having a darker color, so you need larger amount of the sun to develop vitamin D and to develop skin cancer.
So basically your melanin and the dark skin that we develop in hot countries is actually protecting us, but also making it harder for us to get vitamin D. I'm sure you get a lot of this, and I'm sending patients your way for this as well. What about when people have moles and freckles and then they go on holiday and then these seem to increase in number? What would you say about that?
For the freckles, this means that we have skin type 1. This means that they are very light with blue eyes and fair hair. This means that they need a very little amount of the sun exposure to develop vitamin D, and this small amount of the skin to the sun exposure, they develop a skin cancer. This means that the freckles, they have
a warning
more
sign.
Potential to develop skin cancer.
And how much sun exposure does it take to develop a skin cancer?
To develop a basal cell carcinoma, they need 10,000 hours per life to develop basal cell carcinoma. To develop squamous cell carcinoma, you need 70,000 hours all the life to develop squamous cell carcinoma, which is a little bit like more dangerous than the basal cell carcinoma. While the melanoma is different, melanoma is the most dangerous one, and it needs actually an intermittent sun exposure. So let's say it's very common on the back and on the lower legs because this area doesn't always expose to sun. So it's just on and off, on and off. They got a burn when they expose to sun. For that reason, they develop melanoma on the back and on the lower extremity.
And when people get melanomas, obviously that's again more common in the lighter skin types, right?
Yes, there's two kinds of melanoma. The melanoma that affect the lighter people, who it is very related to the sun exposure, as I mentioned, on the back and on the lower legs. But there's also another kind of melanoma which affects the darker people. It might affect end of the fingers, end of the nails, and mucous membrane. This is not related to the sun exposure. And I will gonna mention the sun protection. So it's very mandatory to apply the sun protection on the sun exposed area, and we have to start from the childhood.
Yes.
And now in the summer vacation, we have to repeat it every 2 hours.
We always forget to redo your sun cream and sun blocks, but that's a very important point, especially because you might be in the pool, you might be sweating, and you don't want to not get the protection that these things offer, because the protection is so amazing when you actually use sunblock,
Definitely, and especially on the when the people went to the seashore. So actually the ultraviolet can go directly to the skin, and it goes to the sea, reflect from the sea, and go to the sand, reflects from the sands. Today, the people, they are exposing to triple ultraviolet.
Okay, so it's much worse going to the beach.
So, exactly. So
because it's coming from all
parents
directions.
has to be very careful about the application of sun protection for their children, and repeat it every 2 hours. And basically, wearing clothes is the best sun protection ever.
Yeah, absolutely.
Light clothes will gonna be far much better from the application of the cream. Actually, aging is very related to ultraviolet A. Ultraviolet A can penetrate the windows, the glass. So when are you driving the car, so you are exposing to ultraviolet A, then you are developing aging of the skin. You don't develop cancer, but you develop an aging of the skin. Clothes is very important to protect yourself from the ultraviolet A, and there is specific sun protection that prevent or absorb the ultraviolet A. So not all the skin protection cream can protect from ultraviolet A. Just part of them. Just
so we
be
should
careful.
check what it says onto
exactly.
And so usually it mentions UVA, UVB protection, and then it comes up with a sun factor, a sun SPF, a sun protection factor. Can you tell us what we should be getting for holidays and for normal daily life?
Actually, all the companies of the manufacturers of the skin screens, they make it uniform as SPF 50 plus. So there is no more than 50 plus. What does it mean? SPF 50 plus. This means that whenever you apply it, your protection will gonna be 97% at the time of the application. But after 1 hour, the protection will gonna be 50%. And after 2 hours, the protection will gonna be 0.
Okay.
This means it's mandatory to reapply it every 2 hours.
I think that's something very important that even I should try and remember.
Yes, and I advise always to apply SPF 50 plus, always, even for the daily life or when you go, because you have to reapply it every 2 hours.
Yeah, I think that sounds sensible, because I think we can get fooled into thinking that we don't need so much because we're indoors. But if you've just done the whole sunblock and used the highest factor you can tolerate, then at least you're going to have a little bit more chance at protection.
Yes.
What about things like hydration in the sun?
Hydration in the sun. Actually, the skin which hydrated well, it will gonna reflect the sun protection. It will not gonna be absorbed.
Yeah.
So when the skin is dry, it will gonna absorb the sun and it will gonna damage the skin.
Yeah.
So definitely, moisturizer of the skin is very important for protection of the
That's interesting,
sun.
because a healthy skin is a better barrier against all sorts of dangerous outcomes
from anything, from the bacteria, from the dust, from the sun, from everything.
Yeah, and I advise people that as well, even in family med, that look, your skin's the biggest organ on your body. If we can keep it healthy, then it's less likely to be inflamed, infected, and affected by other things. It's even things like when you're very itchy, if you can moisturize your skin, you'll be less itchy. and then you're going to be
Definitely.
damaging it less by scratching it less. So yeah, I think these things all make sense and they tie in together when it comes to sun protection.
Yes.
Thank you very much. It was a really great chat with you about skin protection and a very important conversation to be had, and I hope everybody can benefit from this like I did today.
Thank you very much.